Urinalysis includes physical examination of the urine, testing of urine, and examination of the urine under a microscope. It can be used to diagnose and monitor various conditions, including kidney disorders, urinary tract infections or UTI, and systematic diseases such as diabetes. Now, for the routine urinalysis, a random urine specimen is required, which means that urine can be collected anytime during the day without any special measures. When the client is suspected to have a UTI or urinary tract infection, it's important to do a clean catch specimen. What do we mean by clean catch? Clean catch refers to cleaning the perineum and the skin on the genitalia to clear away any microbes on the skin that could contaminate the urine sample. The sample should be taken midstream, meaning it should be collected from the middle of the urine flow. This way, the first and last portion of the urine that's more likely to contain bacteria from skin are not collected. A properly collected clean catch specimen will help make sure any bacteria found in the urine specimen came from inside the urinary tract. Now, before we review the details of collecting a urine specimen, here are some common care tips. Based on facility policies, a nursing assistant can collect a urine specimen under the supervision of and at the direction of a licensed nurse who will provide you with instructions. Always confirm the client's identity to make sure the procedure is performed on the right person. Make sure that the specimen container is labeled with the client's name and room number, as well as the date and the time of the specimen was collected. At all times, respect the client's privacy and modesty by remembering to close the doors and window covers and ensuring the client is properly covered. Okay. Now when collecting a urine specimen, first gather the supplies you'll need, including gloves, paper towels, a specimen container, collection device, toilet tissue, and a biohazard transport bag. You may also need a bedside commode, a urinal, or a bed pad. For a midstream urine specimen, you will also need sterile gloves and a clean catch kit. Okay. First, put on gloves and cover the bathroom counter with a paper towel. Open the specimen container and place the lid on the paper towel with the inside facing up. If the client can use a regular toilet, place the clean collection device or specimen hut inside the toilet. For people who can't use the toilet, a bedside commode, a bed fan, or a urinal can be used. It's important to remember that stool can alter the results. So, ask the client if they need to have a bowel movement before collecting the urine. If a midstream urine specimen is required, open the clean catch kit. Provide the client with special cleansing wipes from the kit if they are able to clean the perineum by themselves. Otherwise, assist as necessary. Wrap the wipe around one hand if the client is a biological length. If a midstream urine specimen is required, open the clean catch kit. Provide the client with special cleansing wipes from the kit if they are able to clean the perineum by themselves. Otherwise, assist as necessary. Wrap the wipes around one hand. And if the client is a biological female, use your other hand to separate the labia. Then, use the wipe to wipe downwards from the top of the vulva and towards the anus. If the client is a circumcised biological male, start by placing the wipe on the top of the penis. while in an uncircumcised biological male, first retract the foreskin by gently pushing the skin downwards towards the base of the penis. Wash downwards towards the base of the penis in a circular motion. And now give the client time to urinate and assist as necessary. Remind them not to throw the toilet tissue into the collection device, the bedside commode, the bedpan, or the urinal because this can alter the results. If a midstream urine specimen is required, remind them to start the flow of the urine, then stop it, and then restart it. The sample should be collected from the restarted flow. In addition, when collecting a midstream specimen, biological females should keep the labia separated and uncircumcised biological males should keep the foreskin retracted. Okay, now for most clients, you can leave the room until they finish. Be sure that the call leg is close to the client. Remember to remove the gloves when you leave and dispose of them safely, and put on a new pair when you come back. Don't forget to knock before entering. Provide tissue paper, a moist cloth, or pre-moistened wipes if they are able to clean themselves. Otherwise, you should assist in perineal care. Also, assist the client with hand washing as necessary. If the client uses the toilet or a bedside commode, help them to return to bed. And then, take the collection device from the bedside commode to the bathroom. If the client uses the bedpan or urinal, place the cover and take them to the bathroom. Note the general quality, the amount, the color, and the odor of the urine. Note the general quality, the amount, the color, and the odor of the urine. You may also be asked to measure the urine. Now, to collect the urine specimen, raise the toilet seat and while holding the specimen container over the toilet, pour about 90 to 120 ml of urine from the collection device, the bedpan, or the urinal into the container. The container should be about 3/4 full with urine. Afterwards, empty the rest of the urine into the toilet. Close the specimen container tightly and place it back on the paper towel on the bathroom counter. Be careful not to touch the inside of the lid or the container, especially if when collecting a midstream urine specimen. Now dispose of one glove and use the ungloved hand to hold the biohazard transport bag. Then, with your gloved hand, put the specimen container into the bag. Make sure not to touch the outside of the transport bag with the glove. Dispose of the other glove safely and wash your hands. Now, the urine specimen has to be taken to the laboratory within 20 minutes. Otherwise, it has to be refrigerated until the scheduled pickup time. Finally, make sure to clean and return the equipment to the right place.
To avoid the container being replaced, you need to label the container with the patient's name, current date, and identify the specimen as a 24-hour urine specimen. And don't forget to include your initials.
Hello, good morning, Mr. Winsel. So by the way, I am Julie and I'm gonna be your medical assistant for today. So for verification, may I know your name?
Mr. Jan.
And how about your birthday? And how old are you? Okay, thank you. So for today, I'm going to explain to you the proper way of collecting a 24-hour urine specimen. So shall we start? Okay, so the first thing that I want to do is just give you this container. And by the way, it has your name on it already. So here it is. So So in the first morning, when you're collecting the specimen, what you're going to do is to just urinate into the toilet, and then from the time on, we're going to start the collection. Take note the collection time here, okay? So for the first day and then for the first 24 hours, you're going to urinate into that container. So are you comfortable with that? Okay, so after you finish the following day, we will end the test on the time from the previous day that we started the test. So once the test ends, you're gonna put the time on the container again.
I have a question, miss.
Yes, sure, what is it?
But I forgot to pee in the container.
Well, that's a really good question, sir. If you forgot to urinate into the container, what will happen is that we will have to totally start the test again. Which means to say that we have to discard all the previous urines and we have to start from the beginning.
How about this? What if I have to go out, or should I still have some errands to do?
Well, actually, you have to bring the collection with you, the container with you, or you would have it on a day where you don't have other activities going on. But the important thing to remember is that you need to collect it for 24 hours and the container needs to be refrigerated. Do I make myself clear, sir? Okay, so when you're done with the 24-hour test, you need to bring this back to us as soon as you can and we will get that sent off to the lab.
Okay, that's alright.
Okay, great. So, have you encountered any difficulties, problems, or issues while collecting a 24-hour urine specimen?
None so far.
Okay, that's good to hear. So then, we will take care of that. You're all set to go now, and thank you so much for your cooperation.
Okay, thank you.
Thank you so much and have a great day.
In the case of female patients, they should place a urine hat in the toilet under the seat and then transfer the urine into the bottle with a funnel.